Hey there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Facebook Live. I want to shoot this video for you real quick because this week on Two Anatomy Geeks, I was out of town, so my partner in crime, Janice, stepped in as the second of the Two Anatomy Geeks with Jill Leary to discuss the rectus femoris, because a lot of our clients come in and they talk about, oh, my hip flexors are so tight, or my therapist or my trainer or my massage therapist told me to stretch my tight hip flexors because that's what's causing my low back and or hip pain. So I want to discuss actually the truth about being a specialist and why you can't just chase your client's tightness. So I wrote the book Corrective Exercise Solutions about hip and shoulder conditioning about 10 years ago, and I'm working on the second edition right now. One of the things we teach in our certification courses, and I'm going to write an entire section about in my second edition, is why you can't chase your client's tightness, and I should say why you shouldn't chase your client's tightness, because your clients will come in and think about your clients, your general population, your clients, especially your older clients, clients after surgery, trauma, and or injury. Do they have great body awareness? Do they know how they're standing? Do they know how they're breathing? Are they very aware of their posture and movement habits? Not so much. So when your client says to you, I'm tight, why do we feel the need then to go chase their tightness? Because a client will say, oh, my hip flexors, my hips just feel so tight, and I just need to stretch them out. But if you're not assessing, what are you doing? You're guessing. And that's one of the things we really stress in our certification courses is you must assess, because your assessments help you differentiate yourself from all the other fitness professionals, all the other professionals that are out there that are working with the general population, that are trying to throw formulas or recipes at their client, and they're not doing a thorough assessment to determine if your client actually needs to stretch or lengthen where they're already over lengthened. So let me give you an example. A lot of our clients come in with hip problems and or low back problems associated with their hip flexors, and we'll focus on the rectus femoris. So we think we see anterior pelvic tilt, but think about this posture right here. How many of your clients are actually walking around in this posture? And I want you to do this. If you're in a place where you can do this with me. Can you actually go into anterior pelvic tilt and actually make it feel good? No. No one I teach to, no one I train around the world does that and says, yes, that feels better. Clients are not in anterior pelvic tilt because of two big reasons. Number one, what do we all do? What do all your clients do for the majority of their day? Unless they're a fitness professional like you or a health professional that's on their feet all day long. What do most people do? They sit. Sitting is posterior pelvic tilt. I'll sit over here. Most people don't sit like this in anterior pelvic tilt because it's hard and it doesn't feel good, so they sit in posterior pelvic tilt. So that does not shorten your hip flexors, and especially the rectus femoris. If anything, it over lengthens it. Second reason the majority of your older clients are not in anterior pelvic tilt is because one specific thing happens as we get older. All of us are going through it, depending on how well you've maintained your posture and your movement habits and how many injuries, surgeries, and traumas you've had. We all will have a level of spinal stenosis. Think about your older clients that didn't do exercise, that sat their entire life, that had multiple surgeries and traumas and injuries through the course of their life and tons of compensations. They're not walking around in anterior pelvic tilt, and if they are, it's a hip problem, not an anterior pelvic tilt problem. Most of your clients that have spinal issues, it's related back to osteoarthritis of the spine, and more specifically, spinal stenosis or narrowing of the spinal canal. So again, they will be in posterior pelvic tilt, and they'll be tucked like this. And think about how many of your older clients are stuck in this position. So, two reasons why your clients are not in anterior pelvic tilt and why they probably have overstretched hip flexors. If we think about a rubber band, let me grab a rubber band real quick. So if you think about my rectus femoris coming from my AIIS, and again, this is on Two Anatomy Geeks that we do every Tuesday. It comes from your AIIS, below your ASIS, just below and inferior, and comes down to your patellar tendon and or patellar ligament, depending on where you want to say the actual attachment is. So what it does is when it contracts, it can pull your pelvis this direction, or it can pull your hip into hip flexion and your thigh into your knee into knee extension. Again, it's one of your primary hip flexors, unlike the psoas, which is not one of your primary hip flexors. However, when you go into posterior pelvic tilt, the rectus femoris will become overstretched and feel tight to your clients. And that's why I said you cannot chase your clients. I should say you should not chase your clients' tightness. The difference between being a general personal trainer in the industry and being a specialist that your clients need, want, and will seek out is you are specific. You know how to assess your client and how to determine the most accurate corrective exercises and how to train them in the most appropriate functional exercise progressions. And again, that's why assessment is so important. And again, that's why understanding the base knowledge, functional anatomy, biomechanics, and motor control are so important. So that way you're making educated decisions and not just following the masses who are just looking for formulas and or recipes. Now, what if your client actually does need to stretch their hip flexors, or their therapist or chiropractor or doctor told them to stretch their hip flexors? Well, most of your clients have been taught to do grab their ankle here and then they go like this. And if you look at me, what position am I going into? I'm feeling a stretch in my quad, but I'm also doing what to my low back? Overextending. And I'm also doing what to my abdominal wall? I'm overstretching my abdominal wall. I'm overstretching my psoas as well. And you do not want to stretch your psoas. That's like saying, hey, I need to stretch my diaphragm, or I need to stretch my pelvic floor, or I need to stretch my transverse abdominis. It sounds ludicrous, right? Then why would you want to stretch your psoas, the deepest of your spinal stabilizers? And again, that's why it's so important, like I said, to understand functional anatomy and what muscles actually do to our body. The psoas is your primary stabilizer. The more you stretch like this, the tighter your hip flexors will get and the looser your psoas will get, which will create more compensation. But again, if your clients have been told to stretch their hip flexors by a therapist, you do not, or a doctor, you do not want to tell them to stop it unless you educate them and they make the decision on their own. Now, to make this stretch, if you have to do it or want to do it or you've been told to do it or you maybe need it, like for example, I have a client that has an arthritic hip. They actually do because they do shorten down here, but that's really one of the few populations. People with advanced arthritis in their hip will sometimes have to stretch the front side of their hip flexors. So here's how we have them do it. We always start with the principles of the integrative movement system: alignment, breathing, and control, because that will allow us to stabilize the spine and pelvis position and lengthen the front of the hip if that's what our client needs. We will usually have them put their leg up on top of a surface, and they can grab onto something if their balance isn't so great, but now it's coming down into a split squat position. So now I can hold this position. I'm long, I'm stacked through my rib cage and pelvis. I'm getting a stretch through the front side of my quad and my rectus femoris and my hip flexors, but my spine is stable. I'll do that from the side, so it's the same idea. Long spine, stack that rib cage over top of the pelvis, keep the pelvis neutral. Hook the leg, come down into a split squat position. Your client can always hang onto something if they need to for more balance or support. And now I feel a good stretch in the front side of my hip and thigh without changing my lumbar spine and or my pelvis position. And again, if you're looking to lengthen muscles, especially fascia, you need a 20 to 30 second hold. But again, you want to maintain that alignment between the thoraco-pelvic cylinder and make sure you're lengthening where you need it, not where you don't need it. And that's why we're very careful and very specific about the exercises we have our clients go home and do. And then we always follow it up with some kind of stability work afterwards to help your client own that length that you just helped them create. And that's ultimately how you use your foundational knowledge, your anatomy, biomechanics, and motor control, how you use a systematic process, the integrative movement system, your assessments drive your corrective exercises drive and determine the fundamental movement patterns you need to do with your clients, and that's how you become that specialist for your clients and attract more individuals that need, want, and will pay you for your expertise. If you're looking for more information, check out our website, iihfe.com. Certifications, we have a 3-day introductory certification, the Integrative Corrective Exercise Instructor program, right here, where we teach you the functional anatomy, biomechanics, and motor control. We teach you the introduction to assessment, choosing the most effective corrective exercises for the shoulder, hip, and core, and then ultimately how you progress this through the functional movement patterns so you can help your clients do the things they need to, want to, and love to do. And again, we have lots of certifications, I should say, a few certifications coming up, one in Virginia in 2 weeks. We have one in Boston in less than 8 weeks. And then we'll also be at Fitness Fest in April. We'll also be at the Pacific Northwest brand new FitCon in Seattle, or I should say Bellevue, Washington. And we also have the Functional Aging Summit where we'll be doing a pre-con. Robert Linkle, my buddy, and I will be doing a pre-con on training older adults. So lots of opportunities. Get out there, get to a live conference, because that's where you really own this information. and really differentiate yourself from the rest of the industry so that you become a specialist for your industry, for your community. Thanks again for all you do. We'll see you next time. This is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Make it a great day.